Medicare 2026, official CMS numbers. CMS just dropped the official 2026 Medicare numbers. And if you're on Medicare or turning 65 this year, you need to know what actually changed before your next bill arrives. Part B premium is up almost 10%. The annual deductible just crossed $280 for the first time ever. And if you're a higher income beneficiary, the IRMA surcharge thresholds shifted too, which means some people are going to pay less than they expected, and others more. I'm going to walk you through every single number, straight from the CMS fact sheet released November 14th, 2025. No spin, no carrier agenda, just the official data and what it actually means for you. Stay through the end, because the IRMA section has a specific change that could save certain beneficiaries over $1,000 a year. Real quick, before we get into the numbers, let me tell you who needs to watch this most carefully. If you're turning 65 this year, these are the baseline costs you'll start with, and they're higher than they were when your older friends enrolled, so don't use their numbers. If you're already enrolled, this is your annual check, because your plan's costs may have changed independent of these CMS numbers too, and I'll tell you where to check that. And if you're paying IRMA, the income-related surcharge on top of your Part B premium, the income thresholds shifted this year in a way that's actually good news for people right on the edge of a bra. All right. Let's get into it. I'm going to go through Part B first since that affects almost everyone, then Part A, then Part D, then IRMA. Part B. This is the part that covers your doctor visits, outpatient care, preventive services. The piece most people are most familiar with because it comes directly out of your Social Security check every month. The standard Part B monthly premium for 2026 is $202.90. That's up from $185 in 2025, a jump of $17.90 per month. Now $17.90 per month sounds manageable. But annualize it, that's over $214 more per year coming out of your Social Security check than last year. Every year. Here's something most channels won't tell you though. CMS indicated that the 2026 Part B premium would have been about $11 higher, so around $214 per month, if not for specific policy actions around drug spending, particularly skin substitute products. The savings were passed on to beneficiaries. That's actually notable. Now the Part B deductible. This is the amount you pay out of pocket before Medicare starts covering 80% of your costs. The 2026 Part B deductible is $283. That's up $26 from $257 in 2025. And yes, this applies per calendar year, so you pay this once in 2026. And one important note on the deductible. If you have a Medigap supplement, specifically Plan G, Plan N, or Plan A, check your plan documents, because some Medigap plans cover the Part B deductible and some don't. Plan G does not cover it. That's actually why Plan F still exists for people who enrolled before January 2020. If you're confused about which plan covers what, drop a comment below and I'll do a dedicated video. And then Medicare kicks in on Part B services. Now Part A, hospital insurance. Most people don't pay a monthly premium for Part A if they or their spouse worked and paid Medicare taxes for at least 10 years. But Part A has its own deductible and coinsurance structure that can get very expensive if you have a serious hospitalization. The Part A inpatient hospital deductible for 2026 is $1,736. That's up $60 from 2025. But here's what trips people up. This deductible is per benefit period, not per year. A benefit period begins when you're admitted to the hospital and ends when you've been out for 60 consecutive days. So if you're hospitalized twice in 1 year with a gap of more than 60 days between them, you pay the deductible twice. Speaking of coinsurance, days 1 through 60 in the hospital are covered by your Part A deductible. But from day 61 to 90, you pay $434 per day out of your own pocket in 2026. That's up from $419 in 2025. And for skilled nursing facility care, if you go to a SNF after a qualifying hospital stay, days 21 through 100 cost you $217 per day in 2026. Again, no Medigap, no cap. Part D, prescription drug coverage. This is separate from Part A and B and requires its own monthly premium unless you have a Medicare Advantage plan that bundles drug coverage. The national base beneficiary premium for Part D in 2026 is $38.99 per month. That's up about $2.21 from 2025. But here's what you need to understand about Part D. That base premium is almost irrelevant. What matters is your specific plan's premium, which varies by carrier, state, and formulary. The base premium is only used to calculate the Part D late enrollment penalty. And that penalty, 1% of the base premium for every month you went without creditable coverage, is permanent. It adds to your premium every single month for the rest of your life. At $39 base in 2026, 12 months late means about $4.68 added to your Part D premium every month. Forever. That adds up to almost $60 per year, every year. 2026, Part D KEY, change the IRA's $2,000 out-of-pocket cap on Part D drug costs, takes full effect in 2026. This is the biggest change to Medicare drug coverage in decades. If your medications previously cost you $4,000, $8,000 plus per year in the catastrophic phase, your maximum out-of-pocket is now capped at $2,000. This alone is worth a dedicated video. Mention it here, link to it. I'll be doing a separate dedicated video on the Part D $2,000 cap because it deserves its own full breakdown, but make sure you're subscribed so you don't miss that one. Okay, Irma. This is the section I told you to stay for at the beginning, and here's why. The income threshold for Irma shifted in 2026 in a way that genuinely helps some beneficiaries who were right on the edge of a higher bracket. Irma stands for Income-Related Monthly Adjustment Amount. In plain English, if your income was above a certain level 2 years ago, you pay more for Medicare Part B and Part D than the standard premium. And it hits hard. Here's how Irma works. Social Security looks at your tax return from 2 years ago to set your current year premium. So your 2026 Irma, if you owe it, is based on your 2024 income. Now here's the 2026 specific change. The individual income threshold, at which Irma kicks in, rose to $109,000. That's up from $106,000 in 2025. A $3,000 increase. Why does that matter? If you had individual income of between $106,000 and $109,000 in 2024, you would have paid Irma in 2025. In 2026, you don't. You're back to the standard $202.90. That's a saving of $81.20 per month, or nearly $975 over the full year. Now, if you are paying Irma, and you believe your current income is lower than what your 2024 return showed, there's a process to appeal it. It's called a life-changing event appeal using Form SSA 44. Things that qualify: retirement, divorce, death of a spouse, loss of income-producing property, and others. I'm going to do a full dedicated video on the Irma appeal process. But if this is urgent, the number to call is in the description. Okay, let's bring all of this together. Here's what you should actually do with everything I just covered. Number 1. If you're turning 65 in 2026, use these as your baseline numbers. Your Part B premium starts at $202.90 per month. Deductible is $283 for the year. Budget from there. Number 2. If you're already enrolled and haven't compared your plan for 2026, log into Medicare. Gov/plan, compare and run your plan against the alternatives. Premiums, copays, formularies, and networks all changed on January 1st. What was right for you in 2025 may not be the best option now. Number 3. If you're in the Irma zone, double-check your 2024 income against the brackets I showed you. If you had a life-changing event that dropped your income, start the SSA 44 process now. Number 4. Check your Part D drug plans separately. The $2,000 out-of-pocket cap is the biggest change in Part D in 20 years, and it may mean a different plan structure is now more advantageous for your specific medications. That's everything from the official CMS 2026 Medicare fact sheet. If this helped you, hit subscribe. I publish a new Medicare explainer every week, and I respond to every comment. If you have a question about how any of these numbers apply to your specific situation, your income, your current plan, your state, the number in the description below connects you directly to a licensed specialist. The call is free, and there is no sales pressure involved. Just answers. And if you want to keep going right now, the next video you should watch is the one on Medicare Advantage versus Medigap in 2026. I'll put it on screen right now. Thanks for watching the Medicare Insider. I'll see you in the next one.